has over, sorry about that. SeniorsNL has over 1,000 federal, provincial, and community programs and services that are available to seniors across our province. We can help you understand and work your way through the programs. The majority of the calls of to our office are answered by our information line peer support volunteers.
Excuse me, we are waiting for the deaf interpreters to show up. We got Joy Phil up here waiting for interpreter to show up. She doesn't understand you.
Hi, I am messaging Joy now. So you can continue. I'm going to message her now.
Okay, thank you. Our volunteers, these fantastic volunteers, are seniors themselves, ranging from in their 60s right up through to their late 80s. They are very knowledgeable, friendly, and understanding. There is nothing you can't ask them. So I'm actually going to go ahead and share my screen now to start the presentation. I just want to make sure, could everybody see my screen? Perfect, thank you so much. Okay, so before we start, I just want to let everybody know we have you muted so that there aren't any background noises and you won't be heard. If at any point during the session you want to make a comment or ask questions, please click on the chat icon on your screen and type your question or comment in the chat box in the right-hand side of the screen. And of course, at the end of the session, we will give an opportunity for questions and answers as well. And I would like to go ahead and introduce you to Barb, and she will go ahead and read our land acknowledgement.
Good morning. We respectfully acknowledge the land on which we gather as the ancestral homelands of the Beothuk, whose culture has now been erased forever. We also acknowledge the island of Ukta-Humguk as the unceded traditional territory of the Beothuk and the Mi'kmaq. And we acknowledge Labrador as the traditional and ancestral homelands of the Innu of Nitassinan and the Inuit of Nunatsiavut and the Inuit of Nunatuavut. We recognize all First Peoples who were here before us, those who live with us now, and the 7 generations to come. As First Peoples have done since time immemorial, we strive to be responsible stewards of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in a spirit of truth and reconciliation to make a better future for all.
Thank you very much, Barb.
You're welcome.
Moving along to our Just Ask SeniorsNL session, it is my pleasure today to introduce you to Elizabeth Siegel, Director of Information and Referral Services. Elizabeth manages SeniorsNL information line and the volunteers who answer it, and so much more. Elizabeth has been involved with SeniorsNL since 2004 and took the role of Director of Information and Referral Services in 2015. Go ahead, Elizabeth, take it over.
Hi, everyone, and thank you so much. And just to echo what Catherine said, you'll probably have questions as we go along. Feel free to put them in the chat. We're monitoring the chat. And also there will be time for questions at the end of the presentation. So we, SeniorsNL, are a provincial not-for-profit organization. We've been around since 1990. And our mission is to support, promote, and enhance the independence and well-being of older adults living in our province. Next slide, please. So our mandate is information referral to support informed decision-making. We facilitate the development and implementation of programs, and I'll talk a little bit about that as we go. And we work to influence policies affecting older adults. And next slide. So really, ultimately, we are connectors. Our information referral service, you're going to learn a lot about that. We have community peer support volunteers who are senior volunteers in different communities in Newfoundland. And especially we have quite a few community peer support volunteers in Labrador. We have Friends of SeniorsNL, which is an opportunity if any of you are interested, where we provide you with business cards. So if you come across someone who needs information about SeniorsNL, you can hand them a card and they can call us. We also do outreach and public opportunities. And Catherine, did you want to say a few words about that?
Yes, absolutely. As part of my role as the community relations and engagement coordinator, not only do I facilitate and put together presentations such as Zoom, we also go into out into the community across our province with a range of different topics and for discussions. If you'd like to have a list of those topics, by all means, please reach out to me. My email will be at the bottom of the presentation itself. With that, anybody can certainly go ahead and reach out.
Great, thanks, Catherine.
And Elizabeth, would you mind just speaking up a little bit louder, please?
Sure, absolutely. I'll get a bit closer to the mic.
Thank you.
We also have the Newfoundland and Labrador Network for the Prevention of Elder Abuse. That's to raise awareness of elder abuse. And if anyone's interested in being a member, we have a listserv and we can send out lots of information. So again, just let us know that you're interested.
Yep. And actually, I just want to add on, thank you so much for saying the word listserv. As part of outreach, I do actually maintain a service list to make sure that everybody is updated on the most recent and latest information going across our province. Good to know information as well. If we do have any health providers on the line, I do have a specific list just for you guys of information that you might be interested in. So again, if anybody would like to join our service list, it's only a matter of sending me an email or reaching out to the service center.
Perfect. So, and another way that we're connectors is something that we've been working on the last couple of years. We were lucky enough to receive some funding for a collective impact project. So that means that we're working with systems to help them work together to create a no wrong door approach. For anyone who's ever looked for services and had to go to multiple places or get sent from door to door, you'll understand why we need that. A piece of that is we create interagency teams for seniors who are facing multiple issues, especially if it's from multiple agencies and it's becoming a crisis. We started off in the St. John's area and surrounding area with this, but we have done teams right across the province. So if a service provider is out there who has a senior who is facing multiple issues and needs a team, you see the email for a coordinator. And of course, if you're a senior, please call our information line. And if it's appropriate, we'll put it together a team so that all the service providers serving you can work together. Next slide. And this is really what we're trying to do in picture form. We're trying to put the senior at the center rather than sending them everywhere else. So now a little bit about our information and referral line. Our line is a toll-free line. There's the number. It's open from 8:30 to 4:30. That's Island time, Monday to Friday. And it is confidential. So when people call, we do not see their name and number. So it's up to them to let us know if they would like to share their information. So I think what we do is pretty unique. Catherine already mentioned that our line is answered by peer support volunteers. They're seniors with training. Many of them have been with us for years and years. I think our longtime volunteer, one of them has been here for almost 25 years. They have a lot of life experience to share as well. So we're much more than a directory assistance. We don't just give out a number. We tell people about the services and what they might need to access them. As Catherine said, we answer calls about almost everything. We're not a crisis line, but we do provide emotional support. And just to give you an idea, our average call is almost 12 minutes long. So we definitely like to have a conversation with somebody to find out what they truly need and give them the information and to take your time and have a conversation.
Elizabeth, sorry, this is Kelly. We have in the chat saying the volume is still pretty low.
Okay, let me get even closer if you guys can forgive a close-up here.
Yeah, that's fine as long as yeah.
Okay, So we will make a call on behalf of a senior if needed. So sometimes people do have trouble on the phone. They might be hard of hearing or have literacy issues or just need that little bit of extra support. In that case, we could do a conference call and help them to connect. And we do follow up with many of our callers. If someone is unsure if they have the right service or are really experiencing trouble, we'll check in and say, hey, did you manage to connect and is everything all right? Sometimes the support we provide can continue for months. That's not typical, but if needed, we're absolutely happy to do that. And we support seniors, family members, service providers, community agencies, and government departments. So basically, as Catherine said, anyone who is a friend or caring for a senior or the seniors themselves. So just to give you an idea, we had almost 4,000 inquiries last year, and that's actually up 13% from our previous year. And we're well over 4,000 already this year, and our year's not finished. We did 3,807 referrals to 357 different programs and services at 189 agencies. The reason I like to share that is because there really is a lot of stuff out there that people aren't aware of, and it's always a win when we're able to connect someone to a service. And again, just a look at who connected with us. It is mostly seniors, but we do support family members, and quite often they're adult children who have moved away from the province and trying to support their parents remotely, and agencies and others. So we have a fair mix of callers. And how people connect with us, probably not a surprise, most is by phone. And I will say most of the seniors that call us do not have the internet, or if they do, they have just basic computer skills. So really the navigation that we can provide is important, because without the internet, it is really hard to navigate things these days. We also take emails. We have a contact us form on our website, and other would be presentation walk-ins and that sort of thing. So one thing that we do like to do is examine the needs of our callers. Why are they calling us? And this is information that we share with the government because it helps provide them with really important information about senior issues and what services are out there and what services aren't out there. So no surprise, I'm sure, daily living is 15% of our calls, followed by housing. And I will say financial issues are on the rise. I'm thinking that might be in our top 2 in our next year. Next slide. So the housing needs, those are literally just inquiries for seniors who are looking for a place to live. And that is a big issue right now. Rent has gone up a lot recently. So we are finding a lot of seniors who are actually being evicted because the landlord wants to raise the rent. So housing is a huge issue.
Not very loud.
I'll try to speak up again.
Sorry, I'm getting comments. Sorry, that's me again. My bad, but yeah.
Okay, I apologize. I will talk louder though. Okay, so daily living. Our top referrals about that are home support. Again, I'm sure that's not a surprise. Home maintenance, residential snow clearing, emergency alert systems, that would be like Lifeline, and supportive case management. Next slide, please. So financial needs, emergency food. We are hearing from a lot of seniors who right now cannot afford food. We hear about people looking for financial support for medical devices. So that would be glasses, hearing aids, that sort of thing. Prescription drugs, debt management, and even employment. We're finding more seniors are going back to work just to deal with the cost of living. Next slide. Health needs is also very popular. A lot of these are mental health supports. So those include counseling, caregiver support, grief and bereavement support, that sort of thing. In the last year, we did a lot of work with information on COVID vaccines. And in fact, we were providing this service where people could call us and we would register online for their shots. And we also provide information on programs for people with specific medical conditions. So what resources are out there? I'm about to fire a lot of information at you. And I want to say, don't worry about the details. What we want you to take away from this is that there's stuff out there and we have the information, and you can call us during 8:30 to 4:30 and we will give you all the details. We will email it to you, whatever you like. But this is kind of like a taste of what's out there. So I thought I would go over our top 20 referrals, and it's tax season, and our #1 referral is the Community Volunteer Income Tax Program. So they provide free income tax services for people with a low income. The eligibility is $35,000 for an individual or $45,000 for a couple, and there's a higher figure for Labrador as well. There's clinics all over the province. They're listed online, but you can also call their number as listed. And every year we hold a couple here in the St. John's area as well. So that's a great program. We find people still are out there that don't know about it. So if you know a low-income senior with a simple tax return, because it won't do self-employment or rental income, give us a call and we'll tell you where the nearest tax clinic is.
Hi, Elizabeth, before you get started, I'm not sure if people have their chat open, but Trudy, our information with information and referrals, she's putting in links in the chat for the things that you're mentioning.
Thanks, Kelly. And Trudy is the wonderful person who manages the database, which I'll tell you a bit about, and keeps all our resources up to date. And believe me, that's a full-time job. So some of our other top 20 referrals, we have our own housing list that we send out. Connections for Seniors is a St. John's shelter and does outreach support. We get a lot of referrals for community supports. Our top one is Eastern Health, but we get them from all over the province. And again, no surprise, the last year, vaccines, immunization, that was big. We also get a lot of referrals to the Public Legal Information Association of Newfoundland and Labrador. That's a bit of a mouthful. We call them PLEAN for short, but that is a great organization to be aware of. They provide free legal information, for instance, on wills, power of attorney, advanced healthcare directives, and they also have a lawyer referral service, and they are not for profit. They're a wonderful organization. We also do a lot of referrals to Service Canada, and of course, that's where people are getting their federal pensions from. Unfortunately, we do get a fair number of elder abuse calls, which would be referred to the Adult Protection Act where appropriate. And we probably get at least one elder abuse call a week. So it truly is a terrible issue. We also get people wondering about the Newfoundland and Labrador prescription drug program. And I am going to talk a bit more about that. And the rental housing program for Newfoundland and Labrador housing. We have a Christmas hamper program here. The ones in purple are actually our own resources. So we have a housing transitions booklet. We get people wondering where to donate things. And we get a lot of people calling about the adult dental program. And that's in red because that's actually an unmet need for many. There's very few adults over 65 who are eligible for that. And I will talk a bit more about that too. We refer people to their members of the House of Assembly, and then you'll see some more of our publications. We also refer people to the credit counseling services in Newfoundland and Labrador. Again, another great not-for-profit, and they're not just for people who are declaring bankruptcy. They can help negotiate loan payments, bill payments, they help with budgeting. So they certainly are wonderful, and they're accessible by phone across the province. With food prices, the Community Food Helpline has been in our top 20. Unfortunately, that service is closing at the end of March, but we continue to work with them and also with 211 to refer people to food banks in their area. And City of St. John's has not-for-profit housing, so that's another one as well. So I'm going to dig into a little bit about our database, because that contains all our information where we're pulling out the details for seniors who need information. Our database is a system called iCarol, and we do have over 1,000 active resources. And these resources are divided by health authority regions, so we can give appropriate resources for wherever someone is located. Next slide. So I just thought I'd give you sort of a sample of what our volunteers are looking at when they answered the phone. This is a sample record about the remote patient monitoring program. It's a great program for anyone. In Eastern Health, it's for people with COPD, heart failure, or type 2 diabetes. There are similar programs in every region of the province. And they provide the senior with equipment so that they can monitor their information, such as blood pressure, weight scales, that sort of thing. And then they can connect with the nurse or health professional as needed. So that is one that we actually refer people to a fair bit. And you can see with something like that, someone's probably not aware of that, and they're not going to call and say, can you give me the number for the remote patient monitoring? So that is something we would pull out after we have a conversation. We might hear about someone's health problems, and then we can refer them to this program, which really can make a difference. Next slide. So this is another sample record. This is actually sort of a short-term record because this is something with the deadline of March 31st, and we really wanted to make people aware of this. So it's a one-time federal Canada housing benefit. It's for renters with a low income. It's $20,000 or less for individuals, but for a senior that does not include their GIS. So if you are a senior receiving the GIS or you know of one, and they're renting and their rent is 30% of their income, they can actually apply and get $500. And again, the last day is Friday, March 31st. And next slide. And how to apply. There is a way to do it online. I know that's a long link, but if you Google $500 federal Canada housing, it will come up. And what I really appreciate, because not everyone does have a computer, is you can also apply by phone. And then we have the number there. And one thing to note is that you will need to have your 2021 tax assessment document in front of you, because they will ask for information from that. And there are some other things that you will need to have, so you can call us and we can give you further details. One more sample record. This is a list of foot care providers that provide service at home in the central region. So we also have lists of businesses and in different regions as well. So you'll see the note. One of the questions that was sent in advance to this presentation, because we did offer the opportunity to do that, is whether or not there's any free foot care. Right now, the only way to receive free foot care is for seniors who are diabetic and receive subsidized home support. However, there are some agencies that provide it. For instance, Empower in St. John's provides it to their clinic, but widely, most people have to pay for it. Next slide. So now on to a couple more of your questions that you sent in. The first one we got was universal guaranteed income. What is seniors, excuse me, what is SeniorsNL's position on this issue? And when can we get better health care? I am desperate for a knee replacement. I completely understand waiting for medical supports and the other issue. Now, those are really advocacy issues, and SeniorsNL, our job is really to connect people with services versus being an advocacy organization. So next slide, please. So one of the things that we would do is help people get to the right place. Of course, one of the best places to raise concerns is the seniors advocate. Now, she doesn't do individual issues, but she wants to hear about systemic issues. So both those, better health care, guaranteed income, she would be interested in hearing about opinions about how that affects seniors. And she then makes recommendations to the government on that. There is also the Office of the Citizens Representative, and their job is to make sure that all government agencies, and that includes the health authorities, are following policy. So if you ever feel that you've been treated unfairly, that is a place that you can go and bring the concern. Of course, most people are aware of MPs and MHAs, and we have listings for all of them in the province. And for healthcare concerns in particular, you can also go to the Client Relations Department in each of the regional health authorities. And also, if you are on a waiting list for surgery, I would urge you to frequently check in with your doctor, make sure you're on the list, make sure your name hasn't been dropped, and keep them up to date if there's been any changes in your health, because it is important to advocate for yourself as well. Next slide. So a couple more questions we got. How to get a supporting accommodation even if I am still active and working full-time? I wasn't completely sure about what was meant by this question, but I'm thinking it was probably someone looking for perhaps an apartment or a building where they don't have to take care of yard work, snow shoveling, that sort of thing. And I will say that we have lists, housing lists for all regions of the province. They cover market rent, they cover not-for-profit, and things like Newfoundland and Labrador housing. And that was another question we got. It was late breaking. But is there other housing besides Newfoundland and Labrador housing? And there definitely is. There's lots of not-for-profit housing in different communities. There is co-op housing. I will say though, for most of the not-for-profit housing, there is a waiting list. So if you see a place that you're interested in and you think that might be working for you in the future, I would suggest you put your name on a waiting list right now. And again, we have the housing list, so give us a call and we'd be happy to send it either by mail or email. Another question was, what supports does SeniorsNL have in place for older workers? So again, we're not actually providing direct service. Our job is to connect people to places that do provide services. And there are a couple. There's community centers across the province who will help with resume support. There's the Murphy Center in St. John's. So depending on someone's area, we'll do our best to connect them with a place where they can get support. Next slide. Is there a program that will drive seniors out of town to doctor's appointments, and a program that will help pay for medication I need? There are a few community transportation programs around Newfoundland and Labrador. They've received grants from the governments, and some of them will do that. But again, it depends on your community. I believe this question came from Grand Falls, Windsor, and unfortunately there isn't one in that region. But I did want to talk about two programs that can help. So next slide, please. There is the Medical Transportation Program. This provides financial assistance for travel to medical services that are not available in your own community. Now, the services must be more than 50 kilometers away, one way. And after the first 500 kilometers within a year, you can claim 20 cents per kilometer. And you have to list all medical visits in your application. So I would suggest if you are someone who's traveling from your community fairly often, just get a paper calendar or do it on your computer. Jot in each time you visit a doctor, who it was, what you were there for, and how many kilometers you drove. And once you get over that 500, then you can call and get an application form and start to get reimbursed. They will also, in some cases, help with taxis if there's no way for you to get somewhere otherwise. That's for more than 50 kilometers away. And there's also air transportation available for those in Labrador, or if you need to go to the mainland. So there's the number at the bottom for that. Thanks. And the next one is Newfoundland Prescription Drug Program. So if you're a senior, you're over 65, and you are on the guaranteed income supplement, you automatically receive the 65 plus drug card. So if you have that, you'll know because you're probably paying $6 for each of your prescriptions. Now, if you receive subsidized home support, you are actually eligible for the foundation plan. And people get the drug card, but sometimes they're not always aware of what that makes them eligible for. If you have the foundation plan, that's the one way that you can get into the adult dental plan. So if you're over 65, and on the foundation plan, and you should be on that if you have subsidized home support, you do have limited dental support. So that's a good one to remember. But there's other plans. So this is one that I find a lot of people don't know about. So if your income is between $27,151 for individuals or less than $30,000 for couples, you can apply for the access plan. But this one isn't automatic. You do have to call the Newfoundland Prescription Drug Program and fill in an application, and they will pay for a percentage of your drug costs. And again, a lot of people are not aware of this. And additionally, there's the assurance plan. So that's for people with extremely high drug costs, and they'll put a cap on the amount of drugs that you can that you have to pay for. So when in doubt, find it out. So give them a call and see if you're eligible for any of those plans. And last but not least, I'll just add, we do get questions from people when they have a drug that's not covered under one of those plans. Sometimes you can ask your family doctor to do a special authorization for the drug you need. So if that happens to you, that's just something to keep in mind, and your doctor will know how to do that. Next slide. So here more generally are some of the questions that we receive. Is there an inexpensive way to compose a will? I talked a little bit about PLEAN, the Public Legal Information Association of Newfoundland and Labrador. They have some amazing books, including a legal guide for seniors that will start you down the right path. So that's another great resource. We do get people wondering if there are any kinds of senior discounts on internet services. And indeed there is. If you're in the Rogers area, Rogers does provide it. You do have to be on the guaranteed income supplement for that. And in addition, TALUS has a phone program for seniors who are on guaranteed income supplement. We get a lot of people who are maybe finding it a bit harder to stay in their own home and need a little support. So they're looking for home support. And not everyone realizes who is responsible for to subsidize that or to provide it. So it's community supports in each of the health regions, and we'll help connect people with them and give them the right number for their area. We also get a lot of questions about if there's government financial support if I want to go into a personal care home or a long-term care home. And there is indeed. They'll do a financial assessment and tell you what you're eligible for. But a piece of that is a lot of people are really worried that they'll have to sell their home in order to be eligible. And that's actually not true. They just look at your income and liquid assets. So there's a lot of fear around that, and people might give their home to an adult son or daughter when they're not really ready to do that. So if you have any questions or concerns about that, call us and we'll also connect you to the right people in the health authorities. Again, we hear about people who need to make some adjustments so they can stay at home. For instance, climbing the stairs. So people sometimes need help with stair lifts, ramps, roll-in showers, that sort of thing. And there is an incredibly wonderful program that Newfoundland and Labrador Housing provides. It's called the Home Modification Program. To be eligible, you have to have an income that's less than $46,500, and they will do an assessment, but that can help you do things like the roll-in shower or the ramp or anything that can make a difference for you to stay at home. So again, another great program that can make the difference between staying in your own home or not. Next slide. The application I need to fill out is on the internet, but I don't have a computer. Probably one of the most frustrating things that we hear from people, because of course, what are you supposed to do? Well, we're happy to help. We can either do it on our computer, or if it's a form that we can print out and send to you, we're happy to do that by mail. So if anyone has any barriers, we hope they'll connect with us so we can help. My husband or wife passed away a year ago, and I'm finding it lonely. How can I meet new people? That is definitely a difficult time of life and a big adjustment. For people who have recently lost a spouse, we would connect them with grief and bereavement supports. But when someone's ready to get out and connect with new people, we can help them find out what's going on in their community. In the city of St. John's, we actually have a recreation guide, and we have lots of information on other communities. And if someone calls us from a community and we don't have the information, well, then we'll dig in and we'll do some research and find out the answer. So I had briefly mentioned elder abuse. You actually rarely hear from the people being abused. Usually it's people who are really concerned about another senior. So in that case, there's the Adult Protection Line. And the Adult Protection Act covers adults who do not understand or appreciate the risk of the neglect or abuse they're experiencing. So for instance, if someone had dementia, it is actually mandatory to report, and we've got the information for the line there. But sometimes the adult has full capacity and the Adult Protection Act isn't appropriate. So then we could help with offering things like supports to find new housing, connecting them with legal supports or counseling. So there are some supports for out there. And again, it is mandatory if you feel the adult doesn't understand or appreciate the abuse they're experiencing. And there's the number. I am having trouble hearing people on the phone. Do you have any suggestions for what I can do? Well, the Canadian Hard of Hearing has an amazing equipment loan program. They have phones that help people who are hard of hearing. And the wonderful thing that they do across the province, they'll actually mail out the equipment so people can try before they buy. So it's a great opportunity if you're thinking you need some help with hearing equipment. They can help you make suggestions, and then they'll also send you something to try out. And unfortunately, more and more, we're hearing I can't afford food. And I have bill collectors calling me. So again, we would help someone connect with the food bank, but also we would look at what they're receiving. Quite often people aren't getting all the financial benefits that they're eligible for. In particular, guaranteed income supplement is often missed by people, and that can make several $100s difference a month if they're eligible. And again, with the bill connectors, we would help to connect them with credit counseling so that that situation is improved. Next slide. So I thought I'd give you an example of a bit more of an involved call, because sometimes it's really trying to tease out the details and find out what's happening. So we had a gentleman, Henry, who was 67, and he called our information line because he was in financial difficulty. He had stopped receiving his guaranteed income supplement payments several months ago. So that was a major drop in his income. And in Newfoundland and Labrador, being eligible for the guaranteed income supplement also makes a senior eligible for the 65 plus prescription card. So his coverage had stopped for that as well. So now he was having trouble paying his bills and could no longer afford his medications. Well, the first thing that we needed to find out is whether or not he had completed his taxes, because the guaranteed income supplement is actually connected to filing your taxes every year. And in this case, he hadn't. So we were able to connect him to the Community Volunteer Income Tax Program and get those straightened out. The next step was to let Service Canada know about this so that his guaranteed income supplement could be restarted. So we helped him make that call. But it can take several months sometimes for it to get restarted. And he was really struggling financially. So we also connected with his MP, who can help speed up the process. And of course, once the guaranteed income supplement started again, his prescription drug card kicked in again. So it took a little while, but by managing and calling different agencies, we managed to make everything work for him, and he was able to eventually be financially stable again. So just a few more resources that we provide. I did mention we have housing lists for all the regions of the province. We also have lists of personal care homes, long-term care lists, and retirement homes. We have a quick guide to recreational activities in St. John's. We have a caregiver's guide for people who are providing care for a loved one, and that has a list of resources in it. And we also have a housing transitions guide. And this is sort of a step-by-step thought process to help you figure out whether or not you need to consider moving from your home, or perhaps there's other resources that can help you stay. So after all that information, what is the takeaway? You really don't have to know everything. You just have to know to call us. We're happy to help connect you with the resource. So I hope you will. Next slide. So this is our information again, but we're very happy to take some questions now from the chat. Catherine or Trudy, is there anything that you want to bring forward?
Elizabeth, this is Kelly. There is a question in the chat. It says, my father is 73 years old and he was eligible for doing his taxes last year by phone, but this year he was not and was not notified by phone or mail. Why is that?
So that was probably through the Community Volunteer Income Tax Program. That is something they did during COVID because of course we couldn't hold tax clinics. So that was the difference. Then they were doing it by phone. But with that program, it is the individual's responsibility to contact the program and find out the nearest clinic or us. So every year, if that person would like to have his father give us a call, we'll tell him where the nearest clinic is and connect him with it. Is there anything else?
Not sure if you wanted to stop your slides. I'm not sure if anybody has their hand up. I'm looking at, oh, here we are. Oh, sorry. Oop. The things are going by so fast. Oh, what is SeniorsNL doing regarding rent control and the eviction of seniors? Are they lobbying government to put legislation in place?
Well, again, as I mentioned earlier, we're not really an advocacy organization. And we would help the individuals who are looking for it. But we do communicate very closely with government, with all our stats. So when we have so many housing calls, we're able to let them know that, and we're able to reflect some of what we hear on the information line. So really sharing information about what we hear from seniors is the #1 way that we're trying to help with that.
Yeah. Elizabeth, the question regarding the father, the next comment was, but my mother did her taxes by phone, but my father can't. I'm not sure it's can't because either he has trouble hearing, or I am not sure. That's all the comment was.
I wondered, there is also something that the CRA did for some people with very simple income tax returns. For those individuals, they would have received a letter in the mail saying that they were eligible to call to make a simple one. So perhaps it was through CRA. And I'm guessing if the mother was able to and not the father, perhaps the fathers had maybe some investments or pensions, or is a little more difficult.
Yeah, you can certainly contact us. There is a follow-up to your answer about the rent control, and that they said, well, then who advocates for seniors?
So on the side, I talked about the seniors advocate, and I believe Trudy might have put that information in. And if not, she can do that again. And the seniors advocate deals with systemic problems. So that absolutely is a systemic problem. And she is actively looking to hear from seniors with their concerns.
Yeah, highly recommend that you contact the seniors advocate regarding that, and anyone else who may have issues. A follow-up comment on the father not being able to file his taxes. Apparently he has received nothing. So maybe.
How about you give us a call, or have him give us a call, and we'll see if we can help figure it out.
Yeah, give us a call. The number's on the screen there. Okay. Let's see what we got here. I don't. Is there anything else? Any other comments?
Hi, my name is Janine. I'm with the community support program. I was just wondering if I can provide, I guess, a couple of comments in terms of some of the slides that you went through, Elizabeth.
Yes,
Certainly.
please.
Sure. So I guess you had commented about, I guess, foot care for seniors, and you had identified that it was for individuals with a diabetic diagnosis. So that is correct, I guess, in the event that they are receiving medications through NLPDP. However, that's not the only diagnosis, I guess, or eligibility criteria for that population. So the case manager would also be looking at whether or not there's peripheral vascular disease, if they're taking any anticoagulant medications, any reoccurring nail problems, any corns or calluses that interfere with ambulation, any need for specialized foot care instruments. So there are, I guess, other eligibility criteria that could enable a senior to be able to access that program in the event that they are a long-term client of the community support program. I also wanted just to clarify around the home support subsidies and the subsidies for personal care or long-term care. We no longer look at liquid assets, so we would not be asking what seniors have in their bank accounts. It is considered irrelevant information because there was evidence to support that it was leading to victimization of seniors. So we are now purely only looking at their income. And the other piece I wanted to add was around the home modification program. So in order to be able to access that funding, you actually have to get an OT assessment to support that. So again, that would be accessed through the community support program. So if you're having issues in terms of home accessibility, reach out to CSP and they'll certainly connect you with an OT for some follow-up.
Thank you. Those are all very important clarifications and I really appreciate it. And actually that information on foot care was new to me. I learned something new every single day. So I really appreciate that.
Awesome. Have a good one.
Yeah, thanks, Janine.
Thanks so much, Janine.
No problem.
And
Any other?
what Janine said is there in the chat as well.
Anybody have any other questions or comments?
Any
Going
hands
once? Going twice?
up? Did
Three
you want to
times.
stop sharing the screen?
There is a comment there from Dolores.
Yeah.
They say, Dolores says, follow up, are all lists you mentioned, such as housing list, personal care home and long-term care lists available on your website for download or viewing?
They are not, and part of the reason for that is that's something that we update almost weekly. We hear about new changes. So we do ask that people contact us directly, and you can do that actually through our website in the contact us form and just request it, and we'd be happy to email it right out to you.
Any other questions?
Someone just asked, is our presentation available to view? Yes, this is being recorded and it will be uploaded to our YouTube channel. And once that recording is set and ready to go, Catherine will send out the link to everyone who participated today and who had registered that were unable to make it today.
And thank you so much. We're always here if you have a question. Service providers, I hope you'll reach out to. And also, we're always open to new information. So if there's a new program, either from a health authority or community organization, let us know. We'll put you in the database, and then we can also share that with the seniors who call us.
Okay, so I'm going to share my screen again to go to the end of the presentation. Sorry about that. Okay, so if we do have any, there's Elizabeth's information. If anybody would like to certainly give us a call if you have any type of questions, info@seniorsnl.ca, and Elizabeth's email directly is elizabeths@seniorsnl.ca. If we do have any healthcare professionals, providers on our call that would like to have a certificate of completion for attending our Just Ask Us Anything session, please send me an email so we can send you those certificates directly. The email is outreach@seniorsnl.ca. I'm just going to continue to talk a little tiny bit, stretching this out if anybody just wanted to write down and take note of the email address. And of course, if you do happen to miss that, you could certainly give us a call and we'll provide that to you. One of the topics and programs that Elizabeth mentioned earlier on in the presentation is to be a friend of SeniorsNL. And what this is, it provides you an opportunity to link older adults who have questions and concerns about programs and services and or issues to reach out to us. We would actually provide you with a business card if you're with an organization such as Community Supports, Community Services in Mount Pearl, or could be in Corner Brook. We could actually, instead of putting your name directly on it, we could actually have your program onto it, or your location, your facility's name, if it's Western Memorial Regional Hospital, for example, or if it's from Health Sciences, or if it's actually from an individual themselves, because I'm actually just seeing a name on the screen there now, Tammy Butler. So Tammy, like, say, for example, you would like to be a friend of SeniorsNL. We could, if you wanted to have a business card, we would actually have your name directly on the business card. So what that means is that if you're talking to anybody, you meet anybody that has some issues and concerns and would like more information, you just hand them over the card so they have the information to give us a call. If you also become a friend of SeniorsNL, sorry about that. If you also become a friend of SeniorsNL, there is also a possibility to help us out if there's any type of events going on in your area, or if we're doing any type of learning and education sessions. If you'd like to learn more information about this, again, please feel free to reach out to me. Again, my email is outreach@seniorsnl.ca, or you can give our main line a call where you'll take a message and I'll give you a call back. And this is the end of our presentation. So thank you so much, everybody, for joining today's call. Again, if you have any questions at all, please don't hesitate to reach out to us. Thank you so much. Have a great day, everybody. Bye.